Let's talk now about assisted dying. We saw that private member's bill put forward by the Labour MP Kim Leadbeater earlier in the week, and that's going to go to a free vote among MPs on the 29th of November. Question is how people are going to vote, whether it will actually get through Parliament, and whether there are enough safeguards for those who do agree, like me, that people should have the right to have assisted dying if they are terminally ill. I would like to widen it to people who are facing physical anguish but aren't necessarily terminally ill. But Wes Streeting, the Health Secretary, has already said he will vote against it, but he's also looking into, he says, for a review into the costs of assisted dying, warning that there could be a chilling scenario where terminally ill patients feel pressured into ending their lives to save the NHS money. Well, let's talk about this with Dr. Cajetan Skowronski, who's a palliative care doctor. Good morning to you.
Oh, good morning, Julia.
Thank you very much. Well, thank you so much for joining us. Are you in favour of the assisted dying bill or against it as it stands right now?
I'm very much opposed.
And why is that? Is that in principle, or this particular bill in terms of the safeguards or lack of them?
I think both, really, but because they're linked. I mean, because you have to approach these bills in terms of how they would function in reality. So I've never come across a system whereby killing patients is implemented where it can be safe. So I am against it in principle. I would always oppose it. But I was interested in seeing how the bill will present safeguards, because in the lead up to its publication, we were told that these are very much for the very extreme cases of patients who are suffering immense pain at the very end of their life, for whom the best quality palliative care cannot help them. And I'm very deeply sympathetic to people in those cases, and they are actually very rare. But the bill that was published the other night actually opens the door for physician-assisted suicide of any patient who has a life expectancy of less than 6 months. And we're not very good as doctors of judging life expectancy.
So often we hear of someone who's told they'd only had a few months to live, who's still alive a few years later. But again, in those scenarios, someone may have a great quality of life and not wish to end their life. You say there can be no scenario where it can be safe. I mean, we were told, again, there'd be so many safeguards, 2 different doctors, a judge, everything. I've always wanted there to be someone who's non-medic, a judge sitting on the board on this one as well. I would worry about the safeguards. That's a massive concern for me. But also a lot of people say it's a slippery slope. That first it's 6 months, then it'll be people with a year to live, then it'll be people who aren't actually thought they were going to die. They were actually going to they just live about poor quality of life. But I just think fundamentally, I don't understand why we out of goodness of our hearts, out of kindness, we put down a dog or a cat, a pet animal that we love very much, because their quality of life is so poor, or they're in so much pain, because that's the kind and right and moral thing to do. And yet for a human being, well, no, sorry, you're going to have to live in pain. You're going to have to carry on with your anguish. No matter what you want, we're not going to help you. That doesn't seem to me to be right.
Now, I can see on the surface that might be a compelling argument, but if you think about it, the reason that we can put down animals is because they have so few rights. We don't actually, as a society, value them on anything approaching the level of a human being. So many owners can take their pets to a vet who will put them down purely because the owner says, well, actually, I can't afford this animal.
Yeah, I mean, and I personally find that absolutely shocking and horrific, and I don't think that should be allowed.
But the thing is that if we're saying that it's good that we can put animals down because it's compassionate, well, we have to accept the cost of that. There's all laws are trade-offs.
Yeah.
And the trade-off of being able to put animals who are suffering down is we treat them like animals.
Yeah, I understand that we treat people with greater rights, but I would have thought we should show greater compassion and kindness. I would certainly want the right to have assisted dying for myself and my closest family members. It's something we've all discussed. My mother was a GP. We've had my grandmother died after 20 years of dementia. We've seen that. We've all been very open discussion about what our wishes are. But if we actually wanted to help out of compassion, knowing the views of our loved one, we would go to prison, as opposed to them being able, or me being able to get a physician-assisted suicide. I think that's wrong.
And I understand you feel that way, and people do, but I think it's important to understand the trade-off. So in order for, someone, of your caliber who's really able to make decisions about their life, really, doesn't get pushed around by anyone. In order for someone to have that right, you have to then grant it to people who are a lot weaker and a lot more vulnerable, who that right thing can then be imposed on them. It's a duty to die. And the reality is, in all countries where assisted suicide has been introduced, that the far higher reason, the far more common reason that people state for why they are requesting assisted suicide is because they feel they are a burden. It's not because of these rare cases, and there are some rare cases, but they don't factor in anywhere near as high on the scale.
Yeah.
As
But nevertheless, not wanting to be a burden on, say, your children, and feeling your life isn't worthwhile anymore, I still think that is a perfectly reasonable and loving thing for someone to do. It doesn't necessarily mean they're vulnerable. I would be concerned about people who felt they were being pressured in it, and I wonder if we could come up with safeguards that would prevent that from happening.
I think that's a very dangerous way of thinking.
I think it's how a lot of people think.
Yes, and the thing is that when I have patients, as I do, especially increasingly because of this debate, increasingly patients who feel that they don't have a place in society, they're elderly, they're neglected, they're often sitting on a hospital bed for many weeks waiting for social care, which is broken, in an NHS, which is broken.
And they feel that might be the right option. Cajetan Skowronski, I really appreciate you joining us. You're a doctor, obviously a palliative care doctor. You're actually dealing with this at the front end. I so appreciate your perspective. I hope you'll come on the show again. We have a bit longer to talk about this. Thank you very much indeed.